Well, it turns out that I have to retract my video from last weekend discussing the possibly inflated count of coronavirus deaths. I've been informed by Jim Acosta over at CNN that the evidence that I showed doesn't count as evidence. It's nothing but a conspiracy theory.
There's a lot of misinformation, conspiracy theories out there about the coronavirus.
What do you say to those folks who are making the claim without really any evidence that these deaths are being padded?
You will always have conspiracy theories when you have very challenging public health crises.
I stand corrected. And to be fair, not just by Jim, Dr. Fauci also calls these claims a conspiracy theory all on his own, even when unprompted.
You weighed in on a theory that's been floating around that perhaps the number of fatalities related to COVID-19 is being inflated.
Savannah, there is absolutely no evidence that that's the case at all. I think it falls under the category of something that's very unfortunate, these conspiracy theories that we hear about.
Which is weird, one, considering he's in front of a Health and Human Services backdrop, which, as we'll see in a moment, has explicit instruction and incentive to do exactly what he says is never happening at all. And two, considering his colleague Dr. Birx said just the day prior, yes, we are very loose with our coronavirus death counting.
I think in this country, we've taken a very liberal approach to mortality. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. If someone dies with COVID-19, we are counting that as a COVID-19 death.
It's frustrating to hear these two contradict themselves and say collectively, no, that thing that we say we're doing isn't actually happening at all. Don't be a conspiracy theorist by taking our own words at face value. But that's the trouble with the listen to the experts narrative. That's as far as it goes. It's not listen to the experts for coherence or consistency or even truth. It's just listen to the experts, even if their words start contradicting observable reality, because if you don't, you're a bad person. And besides, listen to the experts presumes the experts are in agreement. You don't mean listen to the experts. You mean listen to a particular narrative and a particular perspective with which some experts agree. The experts are not some high council of unanimity we all must obey for any hope at salvation. They disagree with each other just as much as the rest of us, Rubes. And so in the end, listen to the experts properly translates to shut up and agree with me. And I don't say this hypothetically. I'm not referencing theoretical dissident experts. They are out there. More are emerging every day. It's just they don't get invited onto the big news shows and they can't jump on a presidential podium at their momentary whim. When I discussed the possible overcounting of coronavirus deaths last weekend, admittedly, the case was anecdotal. Numerous documented cases across the country of deaths clearly attributable to head trauma or heart failure or any number of abrupt causes of death for people who also happened to test positive for coronavirus. And I think that case is compelling, but it did lack demonstration of a systemic reason why this is happening. And so the possibility that these were isolated oddities remained. Is it political motive? Is it an abundance of caution? I considered the plausible reasons for why this might be happening, but I'm kicking myself for not considering what should be the obvious reason: the money. And now that I'm done kicking myself, I'm giving thanks to those of you who sent me the information. The new stimulus bill has several provisions that establish special compensation for hospitals caring for coronavirus patients, particularly those patients who are uninsured, and to otherwise compensate hospitals for, quote, lost revenue attributable to coronavirus. In other words, there are financial incentives in place that say more coronavirus means more money. And I know it's cynical, but if you don't think that's an important factor to consider, I present you with an expert to listen to. Minnesota State Senator and family physician Dr. Scott Jensen, who appeared on Fox this week in part to discuss that financial reality.
So you're engaging in conspiracy theories. What do you say to Dr. Fauci tonight?
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do.
And as Dr. Jensen also describes, it's not just a potentially perverse financial incentive. It's federal diagnostic guidelines that are explicitly and intentionally loose. He also appeared on local news this week to discuss the guidelines for counting coronavirus deaths that he received from the CDC. He says these guidelines outright encourage presumption over demonstrated fact.
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19.
So in simpler terms, a patient need not even test positive for coronavirus to be listed as a coronavirus death, and that's not an anomaly. That's the specific instruction of the CDC. In the newly released Guidance for Certifying Coronavirus Deaths, this is the document Dr. Jensen is referencing, the guidance says where possible, conduct lab testing to make the coronavirus diagnosis, but if you can't or you don't do that, if you presume in your clinical judgment that the patient is a probable case of coronavirus, it is acceptable to report coronavirus on the death certificate. And as we heard Dr. Birx explain, whether it's the primary cause of death or just a tangential factor, you can count that one in the scare tally. We have some lockdowns to maintain. Well, maybe this is normal, you may be thinking. Maybe it's not uncommon to put presumed cause of death on a death certificate. Physician judgment is always going to play a part in these calls, sure. But Dr. Jensen says this level of comfort with uncertainty is something new.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know.
And he's not the only one. Internal medicine physician Dr. Annie Bukacek from Kalispell, Montana, has over 30 years experience practicing medicine, much of that experience with death certificates, unfortunately, and she spoke this week about the same issue, the CDC's encouragement to get fast and loose with counting coronavirus deaths.
The assumption of COVID-19 death can be made even without testing. Based on assumption alone, the death can be reported to the public as another COVID-19 casualty. The March 24th, 2020 National Vital Statistics System memo states, and I quote, "The rules for coding and selection of the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not. COVID-19 caused death, end of quote, and quote, assumed death by COVID-19, end of quote, are not the same thing. Dying with COVID-19 is not the same as dying from COVID-19. How many people have actually died from COVID-19 is anyone's guess. But based on how death certificates are being filled out, you can be certain the number is substantially lower than what we are being told.
I want to ask Jim Acosta and Dr. Fauci, how is any of this conspiracy theorizing? These doctors are citing the federal guidelines and incentives provided to them and then explaining the result that is having and will have. And why is this happening? Well, that's anyone's guess. Listen to the experts. Just not these experts.
Why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people. People's ability to think for themselves is paralyzed if they're frightened enough. And that's not where I want people to be. I want people to say, we're going to get through this. I'm going to use my head. I'm going to go to different sources. I'm going to listen to different sources. And I'm going to think for myself, because that's what America's about.
Based on inaccurate, incomplete data, people are being terrorized by fearmongers into relinquishing cherished freedoms. What is that old saying? Something along the line, figures don't lie, but liars sure can figure.
I don't present these doctors to get you to listen to them uncritically either. It's totally possible they're full of crap, and the coronavirus deaths are being undercounted, actually, due to inconsistent counting criteria or people dying at home or any number of factors. There are plenty of people making that case, and you should consider their perspectives too if you're interested in this topic. What I value most from these doctors is not what they're saying about the possible inflation of the coronavirus death count, though I do buy their case. It's not even their broader prognosis for liberty in this country, though I do share their worry. It's what they're saying about thinking for yourself. That is the crucial takeaway here. Every time someone says, listen to the experts to end an argument, beyond asking the crucial question of which experts do you mean, understand the unstated part. Understand they are saying, don't think for yourself. Just bend the knee and the authority will hand down the correct opinion, and you must accept it uncritically. Because thinking for yourself is actually a moral failure. You're a bad person if you do it. And if we adopt that mindset, well, then we've surrendered everything as a country. It is not listen to the experts, because the experts are not a monolith. It is listen to these experts and then listen to those experts and maybe listen to a third expert for good measure. And then after, most importantly, listen to yourself and reach your own conclusions, maintaining skepticism of anybody who tells you to surrender that freedom. Those people are, ironically, the last people to listen to. Thanks as always for listening and for supporting this channel always. Appreciate that thoughtful discussion down below and especially over on Twitter. That is at ML Christiansen. You're always welcome to coming out and chat in my live streams. Those are linked down in the description. Looking forward to it. Goodbye.